Hi, this is Maureen Ryan doing prenatal care. The whole goal is to have a healthy mother and fetus after the child is born. It's a child. This is the politically correct way to refer to it. The goals are obviously to maintain health. It should be a healthy pregnancy. You're going to screen and look for problems. You're going to do education so the mom knows what to expect, the pregnant woman, and to refer to community resources. You'll need to know this for the examination. Initial visit's going to be the first trimester. Hopefully the woman has been on something for folic acid so that there's less chance of a neural tube defect. At the first visit, you'll be doing lots of testing, 12 to 28 weeks, schedule once every 4 weeks, 28 to 36 weeks, schedule every 2 weeks, and so then the last month it's every week. And of course you can adjust this as needed. This is the minimum. Diagnosis of pregnancy, again, this will be on certification. Presumptive are kind of general symptoms, things like not having a period, tenderness of the breast. Probable are more physically significant, increase in white discharge, the bluing of the cervix, the softening of the cervix. Then positive signs are when you actually demonstrate that there's a fetus with ultrasound or fetal heart tones. I always say ask about the last day of the period. Lots of women think that the last day of the period is the day that the bleeding stops. Ask about the planned pregnancy. A lot of pregnancies are not planned, and we want to look at social supports. Pregnancy test measures HCG. It's usually accurate, some are before, but actually within 6 days of the missed period generally. You can do it by blood. This will give us qualitative, yes or no, are they pregnant? Quantitative, how much HCG, and this does go up. If it's a negative test, and you need to repeat it then in 1 week. You'll need to know this as well: gravida, number of times of pregnancy; para, number of pregnancies terminated in the birth of a viable fetus; para, not affected, whether or not the fetus was alive or stillborn. And then we use a 5-digit system, and this is term, preterm abortion, living children. Determining the estimated date of confinement, you will need to know this. Nagel's rule at 9 months and 7 days, first day of the last normal menstrual period. Everyone uses the wheels. Should not be used as far as calculating the estimated date of confinement, and it may be adjusted. Almost everyone has an ultrasound. Usually you have to have a justification like unknown EDC or unknown date of last menstrual period for insurance reimbursement. The first visit is the longest one. You're going to be doing a complete medical family health history, looking for any family genetic problems, look at the social supports, nutritional history, order and evaluate appropriate lab work, and establish the estimated date of confinement. Initial labs, CBC with diff, looking for anemia, etc., blood type and Rh factor, antibiotic titer, serology, rubella, hepatitis B, sickle cell screen, etc. A lot of people, they don't do the GC or chlamydia. This goes back to the STD lecture we had. We offer HIV. If they decline, they do have to sign a form. And then other labs as indicated. You do offer genetic counseling and amniocentesis, particularly for women who are at risk. You're going to do the alpha fetal protein between 15 to 20 weeks if desired. Everyone gets the gestational diabetes screen. You're also checking for glucose at every visit with a urine dip. You can recheck the hemoglobin at 26 to 28 weeks because at this point the fetus may have used up the woman's stores, and at this point you may see more anemia. Use of RhoGAM, the mother is negative, child is positive. There is some mixture of the blood between the fetus and the mother. If the mother develops antibodies, that is going to cause problems for any subsequent pregnancies. So you do this at the beginning of pregnancy. You do this if it has not been done and the patient is having any symptoms of a miscarriage, or during the pregnancy you will do it as well. Once a mother is positive, she'll always be positive. If a mother is negative, you do want to do the antibody testing. You'll have to give RhoGAM prophylactically, 28 to 30 weeks, and if the patient has not had it before, you can wait until 36. You're also going to be testing the baby. Educational topics, we all kind of know this. This is important because the pregnant woman hears a lot of old wives' tales. And so you want to be looking at even some real simple things as far as what can they eat, how much sleep can they have, how often can they have sex, when to call for problems. At the next prenatal visit, they're very short. They're like 5 to 10 minutes. Follow up on any problems, and then you want to see as far as is the fetus growing. You are going to be doing weight, blood pressure, looking for any type of preeclampsia. Leopold's feeling the uterus to see the position of the fetus, and you can usually hear the heartbeat by 12 weeks, and then with the fetoscope by 20 weeks. This is also needed for the certification exam, assessment of the fundal height. At 12 weeks, it starts rising out of the pelvis. They have less urinary frequency. 16 weeks is going to be halfway between the symphysis pubis and the belly button. 20 weeks at the belly button, 20 to 36 weeks, take the weeks of pregnancy plus or minus 2 centimeters, tape symphysis pubis to the fundus. Goes up to the xiphoid and then drops down. At that point, women will say they're breathing better. Return visit educational topics. Again, you want to prepare the woman for the birth, and again, the comfort measures. Nutritional, again, if the woman is underweight, you want to have them gain a little bit more. We also want to keep the weight gain healthy for the woman and the child, and not have women put on 100 pounds. It's not a go crazy. And then giving you the outline as far as how to increase the calories. Weight trends. Sometimes women will lose weight in the beginning because they're nauseous. Some women will have heartburn because of the hormones causing relaxation. You have to look as far as the woman's health beliefs. And you do want to look at far as gaining too much weight, not gaining enough. Pregnancy drug classifications, you need to know this for certification. The pregnancy drug classification, category A is anytime you can just give it. It's safe. Prenatal vitamins, Synthroid. Category B, most medication falls into this area. Animal studies, no risk, but no adequate human studies. Category C, occasionally we'll see animal studies have revealed a risk, but there's no adequate human studies. This would be only if it's really indicated to give this medication. And D, you would really try not to give this one. Again, life-threatening situations. Category X, fetal abnormalities, and then classic tetragenic period will be 31 to 71 days after the pregnancy starts. And women will ask this about what drugs they can take. This will be your biggest thing as far as when you are treating the pregnant woman for a cold, for diarrhea, whatever. You need to know this drug classification. And that is the end of the information that you need for the certification exam. Thank you.